Happy Thursday, everyone. You're watching Atlanta and Company. I'm Christine Pilara. Reproductive Biology Associates has been helping our community for more than 30 years, bringing new life to those who are desperately wanting a family. And we're so thrilled to have Dr. Pavna Brahma here again, because today we're talking about the correlation between breast cancer and reproduction. So thank you so much for being here. Such a timely topic, as it is Breast Cancer Awareness Month. So thank you.
Thank you for having me.
Well, let's start off. Tell us a little bit about the impact of breast cancer on reproductive age women.
Yeah, so as you noted, this October is Breast Cancer Awareness Month, and about 1 in 8 women in the U.S. are going to be diagnosed with invasive breast cancer at some point in their lives.
Right.
For reproductive age women, aged 30 to 40, that is about 11,000 new cases diagnosed per year. So those age categories are also critical years for childbearing,
right.
And some of the impacts of treatments can also have outcome issues on fertility.
Okay, and let's talk about the screenings. What do you recommend for women who are trying to prepare for pregnancy?
Yeah, so all women who are planning on pregnancy should have their health maintenance done. They should be meeting with an internal medicine doctor or their GYN to get their pap smear, breast exams, looking at general hormones like thyroids, etc. And women over the age of 40 should have a mammogram done for baseline.
And let's talk about, too, the elements of a woman's family history. I know that's so important when we're talking about the risk.
It absolutely is. And so some elements of family history could make a woman need earlier screening. For example, having a first-degree relative with breast cancer,
right.
A mom or a sister, that would make a woman need an earlier mammogram or earlier attention paid. Also, certain genes like BRCA1 and
right.
2 can be carried and would increase a woman's risk.
My next question is it common for fertility doctors to recommend mammograms prior to IVF? And I think the answer is yes. And I know a lot of people who watch E! Entertainment and their host, Juliana Rancic, that was made so popular in the public eye when she went in trying to conceive and get ready, and they said, let's go get you have a mammogram.
Yep.
And here she was. I'm not even sure she was 40 yet.
You're right. She was 36 or 37,
yeah.
And you're absolutely right. You know, before getting pregnant, it's a perfect time to think about any risks we may carry, anything we can do to optimize our health. So IVF doctors are going to think about that too, especially in women who are 40 and over, or if an exam shows something that needs to be followed up on. And that's specifically because pregnancy represents a period of time where screening is difficult to do.
Right.
During pregnancy and even with nursing, you know, up to a year after,
wow.
mammograms and other things are inconsistent and not always diagnostic.
Right.
So we really want to think about all those things before a woman's pregnant.
Right, right. I remember I had a scare when I was pregnant, but it was just a duct, you know, but I had to go through it. And so it's as you said, it can be so inconsistent. So make sure you're doing that prior. And we want to talk too, I know, about preserving a woman's fertility. That is what you are so good at Reproductive Biology Associates. So talk more about that.
Absolutely. So breast cancer treatment, and with relevance to cancer, chemotherapy that about 2/3 of women will need actually works by making cells kind of stop growing through toxic drugs, but those drugs are also often toxic to the ovaries. So a lot of women emerge from that with low egg reserve or even may go into menopause early. So thinking about fertility options ahead of time is critical. And luckily at RBA, we've actually been freezing eggs for cancer patients for about 8 years now. And we're able to meet a patient with a new diagnosis, take them through stimulation and actually grow follicles into eggs, extract the eggs and cryopreserve and freeze them in case a woman might need them after her therapy. And you know, I think this whole technology is one of the most exciting advances
really.
in our reproductive field for the past decade or so, because the applications are immense. At RBA, through some of the scientific research published and through other scientists in the nation, the experimental designation has been lifted on egg freezing, so we can now apply it a lot more globally than just to cancer patients. And we're able to freeze eggs in the setting of in vitro to limit the number of embryos created.
Right, right.
We also are doing that for what we call social reasons, meaning women in their 30s or 30s, particularly before the age of 40 ideally, who would like to cryopreserve or freeze their fertility in time in case they aren't ready to start a family yet.
Right.
Because as we know, as we age, the egg number and egg quality go down.
Absolutely. And tell our viewers what you were telling me in the commercial break about some major companies who are making this happen for their employees.
I think it's a really exciting kind of social view, because just this week, both Apple and Facebook announced that they're offering egg freezing for their female employees as kind of a proactive move to help them preserve their fertility. And I think it's just an exciting time for us in reproduction and to potentially impact the future of infertility in our country, but to keep reproductive options open for women.
Absolutely. But in recent news, there have been some questions about whether IVF can actually cause breast cancer. So can you clear that up?
Absolutely. So, you know, IVF does not cause breast cancer specifically, and that has been shown through multiple studies over the course of time. But in vitro medications do increase a woman's estrogen. So that's actually part of why we want to know if somebody has a baseline risk of breast cancer before we stimulate them. Even women with breast cancer can do in vitro, because the egg freezing protocols involve those same in vitro medications, but we spend special effort to try to keep estrogen levels lower through specific protocols that have been studied. And in those cases, we've not seen a decrease in a woman's outcomes from breast cancer if she did freeze her eggs. So, so really there's not an association, but it's also part of why the estrogen levels are part of why we pay so much attention to it.
Right. Same thing about being on the pill, right? There was that for years you always heard that being on the pill for a long period of time could increase your risk.
Right. And you know, all of these come back to the hormonal idea that estrogen is linked to a lot of tumors, but most of the studies will show us that is mainly in populations of women 50, 60, 70 years old.
Got it.
So it does have kind of a different take in the reproductive population.
And what message would you like to send reproductive age women about Breast Cancer Awareness Month?
Yeah. Well, I think more than anything, this month is a special time to kind of be our own health advocates, to step back, make sure we are getting all of our needed health maintenance, and think about other ways we can advocate our health. Also, some of the exciting things we talked about, like fertility preservation, other ways we can advocate for our reproductive potential. I just think it's a great time to take it all in.
Absolutely. It's always a pleasure having you.
Thank
You always
you.
give us such great information. Thank you so much.
Thank you.
And again, if you would like some more information about Reproductive Biology Associates, please give them a call. It's 404-257-1900, or log on to their website at rba-online.com. And this segment was paid for by Reproductive Biology Associates.